Welcome back to MedCity FemFwd. I'm Marissa Plescia, reporter for MedCity News. In this episode, we're joined by Liz Powell, who leads Women's Health Advocates, a lobbying organization focused on educating and advocating for women's health. We discuss the organization's key policy priorities and this year's wins and losses in the women's health space. Hi, Liz. Thanks so much for joining MedCity FemFwd. Really appreciate it.
Wow, thanks so much for having me.
Yes, of course. So maybe just to start, can you just tell me a little bit about yourself, as well as Women's Health Advocates, which you're the founder of? What is the organization and some of your priorities?
Sure. So I worked on Capitol Hill as legislative director for a couple different members. And then I started my own consulting firm, which is G2G Consulting, stands for Government to Growth. And I started to see I had sort of one-off clients here or there addressing a women's health gap, for example, maternal health, and just sort of kept going about my business. But then I realized that it wasn't just one-offs here and there were real patterns or systemic problems. So I teamed up with some others. We built a few different coalitions focused on different areas of women's health. And finally, I realized I needed that overarching, which is women's health advocates. And so we launched that at the beginning of this year that covers all of women's health, which are those conditions that solely, disproportionately, and or differently impact the health of women head to toe over the lifetime. So it's literally everything.
Yeah, super helpful. Yeah, so going off of that, can you tell me a little bit about some of the policy issues that you're really focused on right now, that you're really trying to make a difference on?
Yeah. So, every year they have to do these appropriations bills. So they're moving trains that are wonderful to hop on. Doing those larger authorization bills are important as well. And we do everything from breast cancer to diversity in clinical trials, all kinds of issues. But the real place to shape legislation that's going to happen every year is in the appropriations bill. So we started off the year focused our lobbying efforts on those appropriations bills, and we're now seeing the fruits of our labor. So we lobbied very hard for increased funding for the Office of Research on Women's Health, for example, and we succeeded. So in the House version, it's a 26 million increase. In the Senate version, it's a 30 million increase. And that's huge in an environment in which the president's budget proposal put out a 40% cut to NIH overall. There's other examples. There's other language around menopause that's in there. Representative populations or participation in trials, clinical trials that are representative of disease impact in the population. ARPA-H and that Sprint for Women's Health program, which was this first ever initiative, and continuing that program and funding. So there's a lot of things that we're seeing because we took the time to educate and advocate on these women's health gaps. And I would say the number one thing is taking that time to educate and repeat, a lot of repeat. That has made a huge difference. And I think that there's a lot of members of Congress who just don't know. And so our job is to make sure that they're educated on these gaps and that there's meaningful solutions to those.
Yeah, absolutely. Going back to what you mentioned in the beginning, can you tell me a little bit more about why you felt it was important to create this organization and have an organization that is focused on women's health policy specifically?
Sure. So as we saw in the past few years, there's just been a lot of momentum in the women's health space. There's been folks on the investment side, the innovation side, clinical side, patient advocacy. And what happened is that people finally started talking to each other and started collaborating. Now we've got all kinds of collaborations that are happening in this space that shows that the demand is really there, the interest is there, and that a lot of what it takes to get success to really move the needle in this space is bringing all that together. And so the ecosystem is actually pretty powerful. However, while there are many that focus, there's many nonprofits that focus just on breast cancer or fibroid tumors or specific issues. There isn't any lobbying organization that's on the whole of women's health, all those women's health issues. And that's where I saw a huge opportunity for us to step in and fill that void.
Yeah, so well said. Yeah, going off of that, when we're nearing the end of the year, now we're in November. So when you look back on this year in the women's health policy space, what would you consider to be some of the wins and some of the losses?
Yeah, I mean, it was a tough year when it started out with all those grants being cut and terminated. So we actually planned the first ever Women's Health Capitol Hill Day on May 21st, which was the week that many members of Congress were pulling all-nighters to get that budget bill done. And so we came to the Hill. I analyzed all 800 grants cut at NIH and turned it into a new list of all those that were impacting women's health, which was two-sided single space. So it was a lot. And we took that around Capitol Hill and talked to different congressional offices to explain this is what's happening. And so in the end, we didn't get those grants reinstated. That's still on hold. So that's maybe a battle that we lost. But, to use that analogy, the war's not over, right? Like there's still so many more things. And we did see successes for the Office of Research on Women's Health, for example. So, with every effort, when you're trying to advocate for something, you don't get everything you want, but you can get some things. And so that's what I try to remind our advocates, that you've got to keep the faith, you've got to keep at it, because we'll get more successes long-term if we stick with it.
Mhm. Yeah.
Yeah.
Yeah. And what is some pending legislation that's happening right now that you think that more people should be aware of that's not getting enough attention in the women's health space?
Sure. So within our women's health advocates, we have a really strong subgroup called the Breast Cancer Early Detection Coalition. And we're very passionate about early detection because when it's caught early, it's like 99% survivable. And too often it's caught late because we're not using the right screening tools. So every woman should get a mammogram, absolutely. But for women with dense breasts, they need more than a mammogram, which is called supplemental or additional screening. And you might be surprised to know, many might be surprised to know, it's actually 40 to 50% of all women have dense breasts, and 71% of breast cancer patients have dense breasts. So there's a real nexus there. And that additional screening is nothing complicated. It's ultrasound, it is an MRI, molecular breast imaging. These are all technologies that are in the marketplace. They're readily available. We just need the doctors to be prescribing that additional screening, and we need insurance companies to cover it. So we have been very passionately advocating for the Find It Early Act, which ensures that you have that coverage. So if the doctor says you need additional screening, it is covered. Because right now, not only do patients not know to even push for that, but doctors often, if they see the insurance doesn't cover it, they're like, well, why would I offer it? The patient can't get it. So that is a bill that we're very supportive of and hoping that we see enacted.
Yeah. And what about bills out there that you're not in support of that you feel like people should be more aware of?
Okay. We are an organization that supports all people. So I think there's been some legislative measures to block people being able to identify as they, for example. We support all people. We support all birthing people, for example, all different kinds of families. So I think that there's definitely been some controversial legislation out there. Another, top issue is fertility. That's really important to this president and his administration, which is great. It's very important to many of our folks as well. But how we address it is really important. It's a whole spectrum of things that impact fertility. And so we want to make sure that we're addressing all of those. And so we've done some Hill meetings on that in particular to make sure that they know it's not just IVF. There's like a lot of things that that lead and contribute to infertility that can be addressed before IVF. And that if there's any effort to provide insurance coverage, for example, it shouldn't just be IVF. It should be these other measures as well, as another example.
Can you expand on that a bit? What other measures besides IVF would you like to see?
For example, like PCOS blocks the ability to ovulate. And so there's like an ablation procedure, for example, where you can then enable ovulation and have babies. So that is a much simpler procedure. It's much less expensive, for example, than IVF.
Got it. Thank you for expanding on that.
Yeah.
Yeah, and you also work with several other healthcare stakeholders, aside from lawmakers like doctors, hospitals, and whatnot. Can you share a little bit about how you're working with those in the healthcare industry?
Yeah. So our leadership team includes epidemiologists, several doctors, investors, businesswomen. So we try to have the whole ecosystem from the top down, everyone involved. I would say from that clinical perspective, Dr. Jocelyn Fitzgerald is one of our leaders, and she is a urogynecological surgeon and has studied the different CMS reimbursement codes, over 100 of them, and found that on average, they're 30 to 40% lower for women if it's a female patient, even though it's essentially the same surgery, which is crazy. And some of the codes, it was as much as 150% less. So that information has informed a lot of our advocacy on the Hill, and most people have no idea about that discrepancy. And so we've been working with a few offices on what kind of amendments or language could we insert into legislation that equalizes and removes that. It's a really complicated system that where they set values for different procedures. And so it's a larger, bigger problem. However, you could at least equalize the surgeries that are essential, that don't involve gynecological differences, like it's the same urological procedure. You could equalize that right away, for example. So that's an example of something that we're working on that's directly related to the clinicians on our team.
Oh, great. And what advice do you have for healthcare stakeholders like providers, hospitals, insurers, employers, and how they can move along some of these important women's health policy issues?
Yeah, I think it's really important to have a voice in the system, right? So whatever lens you're looking through, it's valuable. We need everyone. We need the hospitals, the payers, the patients, the doctors, the researchers, the investors. Like every lens is key to making this ecosystem work better. So I think my number one piece of advice is to make sure you're sharing your expertise and your data with decision makers. Those decision makers could be in Congress, they could be at Department of Health and Human Services, it could be at CMS, NIH, wherever. But don't just sit on it. Definitely don't sit on it and sort of be angry about why isn't the system working. Let's try to work together to change that system.
And as someone who has worked on the Hill for a while, how do you feel like things have changed in the women's health space? Do you feel like people are becoming more and more open to, um, making changes and improving women's health, or has it been kind of like an ebb and flow battle?
A little bit ebb and flow, but I think it's definitely increased. And, another interesting factor is we all sort of advocate or lean towards what we know. And we're seeing more and more women in Congress. So you're naturally going to see more and more interest in menopause, for example, right? Or maternal health. And so we have now, it's about 28% women in our Congress. And that makes a big difference. We're seeing many more bills addressing these women's health issues. And interestingly, I remember the first menopause bill was in the 117th Congress at the very end by a man who retired. He didn't run again. So, but then in the 118th, we really saw tons of interest and attention, and not just in separate bills, but also in the appropriations bill. So that's just an example, but I'm very hopeful. I'm seeing increasing interest and appreciation that there are sex differences down to the cellular level. And what does that mean for data? And what are we getting the data in that's truly representative of that? Are we analyzing it and applying it to research and how we make medical decisions? So I think that there's a greater appreciation for that.
Absolutely, so well said. Well, I just have one last question for you. Earlier I asked you about the wins and losses in the women's health space in 2025. What do you expect in 2026? Are there any additional changes you hope to see, or are concerned about?
Yeah, I mean, well, I think we've had great successes, especially in a challenging time where it's all about cuts. So I think that's awesome. We'd love to continue that. But next year it's an election year, and politics is always at play here. So there's lots to build on, I think, with this year that we want to do next year, and then we have to be cognizant of elections. And honestly, I think that this is very bipartisan, nonpartisan, what we're working on. And so we want to make sure that those in office and those running for office know about women's health gaps and know that there are solutions out there. There are things that we could do to make it better. And I think because of that, we will see more and more attention for women's health. So I'm very optimistic that it's just going to keep growing and that we're going to keep coming up with solutions.
Yeah, well, that's a great note to end on. Liz, this has been great. Thank you so much for taking the time and for joining Med City FemFwd.
Thank you. This has been great.